Two of the country's largest doctor groups have issued new guidelines for treating achy bones, muscles, joints, and more. Physician and journalist Dr. Bob Arnot is here with more information on these problems that account for 65 million healthcare visits a year. Good morning to you, doctor.
Morning.
Why are these new guidelines such a big change in how we treat pain?
Because they fundamentally change the way most Americans think about treating pain. Instead of reaching for pills, the American College of Physicians and the American Academy of Family Physicians strongly make the following recommendations and on very good evidence. Clinicians should treat patients with acute pain from non-low back musculoskeletal injuries with topical, non-steroidal anti-inflammatory drugs that we know as NSAIDs, with or without menthol gel, as first-line therapy to reduce or relieve symptoms, including pain.
Why is it so important for Americans to rethink pain management?
Because of the terrible side effects you have with many of the oral medications. And first and foremost, these organizations are addressing the opioid problem. In this same guideline, they looked at 13 million U.S. insurance claims, and here's what they found. If you were at high risk, there was a 27% chance you continued on the opioid, and even at low risk, general population, a 6%. So it's a great balance here between very, very low risk of any kind of adverse reaction and terrific results, and moving from centrally acting pills to locally acting topicals.
How effective do you think topical therapies are when it comes to treating pain, and do you have some examples?
Sure. So they're highly, highly effective. Many good studies. One I've been using is Salonpas Patch Large in the green box. This has been approved by the FDA. It's available at local stores. I actually used this in a big race a few years ago, a 7-hour grueling paddling race across the water between Molokai and Oahu. And the patch has actually stayed on for the whole 7 hours. So available at all your local pharmacies. And again, in this COVID era, you want to go to the doctor's office or you want to go to the hospital if it's a real emergency, something serious. But if it's minor ache or pain or a bruise or whatnot, it's a great way to be able to treat it safely at home.
What type of injuries would you suggest using a topical pain reliever for?
So they were very specific. They said when treating acute musculoskeletal pain, non-low back. Now, this includes muscle strains and sprains, soft tissue injuries. Now, while not evaluated in this study, but many others, topical pain relievers can also be used for joint pain, as well as wear and tear arthritis, which I've got in both my knees and for which it works very well.
And then where can we go for more information, doctor?
So there's a great site. I use it all the time. It's salonpas.us, not .com, but salonpas.us.
Great. Thanks so much for your time.
You're welcome.